Hello everyone, my name is Dr. Manasa Mainipalli. I'm an endocrinologist. So today we'll be discussing about the topic called why people with diabetes need to take care of their foot. Around 15% of patients with diabetes will develop foot ulcer in their lifetime, and along with that, diabetes is the most common cause of non-traumatic amputations of the foot in India right now. How does diabetes lead to foot ulcer? The first thing is that whenever there is an uncontrolled sugar, there is a damage that is done to the nerves. We also call it as microvascular complication or diabetic neuropathy. Along with that, there is a reduction in the blood flow to the foot. And per se, diabetes also leads to reduction in the blood flow to the foot. Because of both these reasons, any diabetic patient will be at the risk of developing a diabetic foot ulcer in their lifetime. So what are the signs that you should look for whenever you have a risk of developing a diabetic foot ulcer? First thing is some amount of numbness, burning sensation, tingling sensation in the foot would be observed, more so in the nights when compared to the daytime. The second thing is whenever there is an untreated wound, there is a risk of it to develop into an ulcer. Third, whenever there is a non-healing ulcer, there is a risk of amputation in the foot. So, because of all these complications, there would be damage to the quality of life of the patient. The good news is that all these complications pertaining to a diabetic foot are preventable. The most important tips that we need to take care of a diabetic foot are: first thing is inspect the foot daily. Look for any blisters or any burns or any ulcerations that you observe. Second thing is you should keep the skin very dry and clean. The third thing is that cut down or trim the nails properly and don't overdo it because it can lead to ingrowthing of the toenails. The most important point later that comes, that is the fourth one, is that moisturize the feet daily. Moisturizing of the feet daily, it helps us to prevent the cracks and thereby which lead to infections. So whenever you're moisturizing the feet, you have to moisturize it on the top and bottom part and leave the spaces between the toes, because those areas, if they're moisturized, it might lead to fungal infections. The fifth point is that whenever you are walking, please avoid barefoot walking. You have to use a very well protected footwear, diabetic footwear, which is very well fitting. It should not be ill fitting, should not be very tight or very loose. The sixth one is regular monitoring of your blood glucose levels, because when the blood glucose levels get uncontrolled, there is automatically a risk of developing a diabetic neuropathy, further leading to risk of developing diabetic foot ulcers. So all the complications related to diabetes are prevented by doing a self-monitoring of blood glucose regularly. So what is SMBG? Let me say it. SMBG is what the patient by themselves monitor their blood glucose levels with the help of a glucometer at home, instead of coming to the hospital or to a lab to give their blood samples. This becomes very easy to the patient, because in a week, I recommend the patients to check their blood glucose levels if it is a type 2 diabetes once in a week, that is by fasting and after postprandial values. And if it is a type 1 diabetic patients, I ask them to do it at least thrice in a week. This regular monitoring of blood glucose levels helps us to keep the track of our glycemic levels, thereby preventing all the complications related to diabetes. So what we should remember here is 3 M's, that is monitor, measure and manage. That is, whatever we are monitoring, it will be measured, and whatever we are measuring, it would be managed by your doctor to keep your blood glucose levels in a target range. Thank you.